Hello, class. This is Quiz 1 Review covering chapters 2 and 3. Ron accepts himself and his flaws. His attitude is best described as self-compassion. This is also known as being kind to oneself. An ability to monitor and use emotions to guide thinking and actions. That's emotional intelligence. Think of it as favoring one's intelligence over emotion. The ability to draw on internal resources independent from familial and societal influences. We're talking about autonomy. These outside influences, of course, can be family, friends, but also social media. The habitual focusing on and appreciating the positive aspects of life. That is gratitude. I actually recommend journaling gratitude for 7 to 10 days to learn how this small change can influence thinking and behavior. Which level of psychological health tops the Maslow pyramid? That would be self-actualization or the fulfillment of one's potential. The levels that are beneath that also need to be accomplished are self-esteem, love and affection, safety and security, and physiological needs. The criteria by which one makes choices about one's thoughts, actions, goals, and ideals. We're talking about values. The tendency to seek out, remember, and expect pleasurable experiences. That is optimism. Optimism is the opposite of pessimism. Which type of health encompasses the ability to identify one's basic purpose in life and experience the fulfillment of achieving one's full potential? That is spiritual health. Spiritual readings increase calmness, inner strength, and meaning, and improve self-awareness, as well as enhance a person's well-being. Additionally, religious support can lower depression and increase life's satisfaction. The capacity to sense, understand, and tap into ourselves, others, and the world around us describes spiritual intelligence. Unlike spirituality, spiritual intelligence centers on discovering the wisdom within us rather than worshiping God. When you blank, you reclaim your power to choose. That is forgive. The Greek translation for the word forgive means letting go. The ability to perceive reality as it is, respond to its challenges, and to develop rational living strategies describes mental health. Confidence and satisfaction in oneself describes self-esteem. Another way of looking at self-esteem is positive thinking and positive self-talk that help to improve a person's self-esteem. Severe depression, alternating with periods of manic activity and elation, describes bipolar disorder. Bipolar disorder was previously termed manic depression. So you might hear either term, but know that they are the same thing. Which disorder can be defined as sadness that does not end? That's major depressive disorder. Major depressive disorder is treated with psychotherapy, also called talk therapy, and a class of antidepressant medications known as selective serotonin reuptake inhibitors. You might have seen them as SSRIs. These are medications like Prozac, Zoloft, Lexapro, Paxil, and Celexa. Chronic distress is characterized by excessive or unrealistic apprehension that causes physical symptoms such as restlessness, fatigue, and muscle tension, and this lasts for 6 months or longer. That's generalized anxiety disorder. Generalized anxiety disorder has the same treatment as major depressive disorder. So again, that is talk therapy or psychotherapy and selective serotonin reuptake inhibitors or SSRIs. The field that combines the study of the brain and the mind is neuropsychiatry. Neuropsychiatry incorporates elements from psychiatry, neurology, and neuropsychology. This type of therapy centers on interpreting behaviors in terms of early experiences and unconscious influences. That is psychodynamic therapy. I want you to remember that psychodynamic therapy was developed by Sigmund Freud. Inexplicable terror, usually of impending physical disaster or death, that describes a panic attack. Whenever one experiences a panic attack, the main thing to remember is to breathe. Oxygen to the brain is needed to reverse any symptoms associated with a panic attack, and anyone is subject to experiencing one. Out of the ordinary, irrational, intense, persistent fears of a particular object or situations. These are anxiety disorders. The treatment for anxiety disorders involves behavioral therapy and medical hypnosis. A neurodevelopmental disorder that causes social and communication impairments is autism spectrum disorder. The symptoms associated with autism spectrum disorder are severe, however, they vary widely. However, 1 in 68 children in the United States are diagnosed with autism spectrum disorder. Licensed medical doctors who complete medical school, a year-long internship, a 3-year residency that provides training in psychotherapy, talk therapy, psychopharmacology, and the treatment of mental disorders, these are psychiatrists. Psychiatrists, well, actually, not gonna share more about psychiatrists, but you need to know that term for your quiz. Drugs used primarily to treat symptoms of depression. We're talking about antidepressants. The purpose of an antidepressant is to reduce symptoms. It does not cure depression. An anxiety disorder in which the apprehension or experience of reoccurring panic attacks is so intense that normal functioning is impaired. That describes a panic disorder. The two primary forms of treatment for a panic disorder are cognitive behavioral therapy and medications. A spectrum of difficulties in controlling motion and sustaining attention, including hyperactivity, impulsivity, and distractibility. This is attention deficit hyperactivity disorder, more commonly known as ADHD. This disorder is characterized by a spectrum of difficulties, as I've already mentioned, and there are more than 100 different types of ADHD. So sometimes it's difficult to diagnose, and oftentimes it is a condition that is lifelong. Some children actually do improve, but for the most part, it's a lifelong condition. All right, a behavioral or psychological syndrome associated with distress or disability, or with a significantly increased risk of suffering death, pain, disability, or loss of freedom. That's a mental disorder. All right. We're down to the extra credit question, which is worth 7 points. All the other questions are worth 4 points. It will come from your mental health in college video. So I encourage you to watch that before beginning your quiz. Your quiz will open on Thursday, June 20th at 6 a.m. and will close on Friday, June 21st at 11:59 p.m. at night. Please do your best to not miss that window, as this summer session is fast-paced and making up work is not quite so easy. So I wish you luck, and I will be talking to you all very soon.